Good evening, everybody. Let me confirm if my audio is okay to you all. We will start the class in 30 seconds. Be ready. All right. Good evening, everybody. In today's class, let us try to learn some important multiple choice questions which were asked in previous Gpat examinations. And these questions will be important for us uh, for writing NIPER, Manipal entrance examinations, and PG set also. So let's begin the most important multiple choice questions. Without wasting time, let us begin our discussion. So the first question, this was the question which is asked in 2021 GPAT. So let me read out the question. A long-term use of thiazide diuretics in hypertension can produce all of the following except. So here we have hyperkalemia, hyperuricemia, we have hyperlipidemia, and hyperglycemia. So these are four options which were given. To answer this question, let me tell you some basic points about thiazide diuretics. See, in thiazide diuretics, one thing you have to understand, just imagine this is a glomerulus and this is a proximal convoluted tubule. This is loop of Henle and this is distal convoluted tubule. This is proximal convoluted tubule PCT. This is loop of Henle and this is distal convoluted tubule. So on the distal convoluted tubule, thiazide diuretics will show its action. So the first point about thiazide diuretics is thiazide diuretics will try to inhibit the reabsorption of sodium and chlorine through sodium chlorine symporter. We have sodium chlorine symporters at the distal convoluted tubule. Especially in the early distal convoluted tubule, we have sodium chlorine symporter. So thiazide diuretics will inhibit these sodium chloride symporter, and by that what it does, it will excrete the excess amount of sodium and chlorine, and in the later parts of distal convoluted tubule it will mediate in excretion of potassium. It is mediating in the excretion of potassium. So when potassium excretion is done, thiazide diuretics will cause hypokalemia. Thiazide diuretics will cause hypokalemia. So here the first point, thiazide diuretics is causing hypokalemia, not hyperkalemia. And along with these, thiazide diuretics will cause hyperuricemia, hyperlipidemia, and hyperglycemia. These 3 points are very important. I'll discuss these 3 points. See, long-term use of thiazide diuretics in hypertension can produce all the following. It causes hyperuricemia, hyperlipidemia, and hyperglycemia, but it causes hypokalemia. So from the option, the except option was hyperkalemia. Actually, thiazide diuretic is causing hypokalemia, and the option they have given was hyperkalemia. So the answer for the first question is A. I think you understood this point. To understand in detail about thiazides, let me tell you some important points about thiazides. First point what we have to understand is thiazides will inhibit sodium chlorine importer. Through that it will excrete the sodium and chlorines from the body. And actually this mechanism is seen in the early distal tube, but in the late distal tube it will exchange sodium and potassium, and by that it will excrete potassium from the body, and through that what it does is it will excrete potassium and it will cause hypokalemia. So this is first point. Second point about thiazide diuretics is it is causing loss of sodium, it is causing loss of potassium, it is causing loss of chlorine, and also it is causing loss of bicarbonate ions. So thiazide diuretics will cause hyponatremia, hypokalemia, and chlorine levels are also will be decreased in the body when thiazide diuretics are given. So this is second point. And third point about thiazide diuretics, this is very important. It has some specific ADRs, like it causes hypokalemia. This point we have already discussed because it is excreting potassium. It causes hyponatremia because it is excreting sodium. It causes metabolic alkalosis because it is excreting HCO3 minus ions. It also causes hypomagnesemia and hyper. Here you see it is causing hypomagnesemia. Magnesium is also excreted along with the urine. So it is causing hypomagnesemia, and very important point is it is causing hypercalcemia. This is very important point. In the upcoming questions, they may focus on this question. Thiazide diuretics will cause hyponatremia, hypokalemia, and loss of chlorine, but it will cause reabsorption of calcium. By that it causes hypercalcemia. Remember this point. Thiazide diuretics will cause reabsorption of calcium from the body, from the urine actually, and by that what it does, it will increase the calcium levels. So if any patient who is having uh, hypocalcemia, or if the patient is having osteoporosis, in that cases thiazide diuretics will be drug of choice, especially in older populations, because it is reabsorbing calcium and it is causing hypercalcemia. This is very important point. This is third point. And the fourth important point about thiazides is thiazides will also cause hyperglycemia, hyperlipidemia, and hyperuricemia. These 3 points were given in the question as options. These are metabolic disorders, these are electrolyte disorders. And finally, the fifth point about thiazides is it causes impotence. So thiazide diuretics are not good choice in adults who are sexually active. The patients who are sexually, in both females and males, those who are planning for the conception, for that candidates thiazide diuretics are not good choice because they may cause impotence cause करने के chances बहुत ज़्यादा है for thiazides. So these are 5 important points you should remember about thiazides. First point, mechanism of action. It inhibits the reabsorption of sodium and chloride through sodium chloride import, and it causes loss of sodium, potassium, chlorine, and bicarbonate ions. It causes hypokalemia, hyponatremia, metabolic alkalosis, hypomagnesemia, and it causes hypercalcemia. It increases reabsorption of calcium into the body from the urine. This is important point. And the fourth point is it causes hyperglycemia, hyperlipidemia, and hyperuricemia. And finally, it causes impotence. So it is not a good choice in sexually active candidates, especially adults. Now, yes, so this is the summary of thiazide diuretics. Yes, I was telling thiazide diuretics will increase the excretion of sodium and chlorine. It will increase the excretion of potassium. It will decrease the calcium excretion. This is important point. And by that, what it does, it will increase the reabsorption of calcium from the body, and by that, it causes hypercalcemia. Very, very important point. And it inhibits the sodium chlorine symporter, and by that what happens, sodium and chloride excretion will be increased. This point anyways we have discussed. And yeah, this is about thiazide diuretic important points. I think first question is clear to you all. Answer is hyperkalemia because it is causing hypokalemia. We'll go to the next question without wasting time. So let me read out the second question. Which of the following calcium channel blocker, CCB means calcium channel blocker, which of the following calcium channel blocker is used as anti-anginal agent? Actually, calcium channel blockers are used in hypertension as well as in the angina, and they are also used sometimes in some cardiovascular disorders. Which of the following calcium channel blocker is used as anti-anginal agent, which has the highest possibility to produce negative inotropic effect, AV nodal block or AV conduction velocity, and which causes bradycardia and decreased cardiac output? So these all actions are associated on the heart. And the drug which causes constipation, edema, and is contraindicated in sick sinus syndrome. So among all these drugs, which drug shows negative inotropic effect, AV nodal block, bradycardia, decreased cardiac output, constipation, edema, and which is contraindicated in sick sinus syndrome is the question. To answer this question, let me tell you, in calcium channel blockers, remember one thing, in calcium channel blockers, we have two types. One is non-dihydropyridine, non-dihydropyridines, and non-dihydropyridines, and the second one is dihydropyridines. Non-dihydropyridines will act on heart, remember this point, and dihydropyridines will act on blood vessels. And examples of non-dihydropyridines is diltiazem and verapamil. And the drugs from dihydropyridines are nifedipine, amlodipine, felodipine. We have all dipines. All dipines are dihydropyridines which will act on blood vessels. When calcium channels are blocked on the blood vessels, vasodilation will be taken place and blood pressure will be decreased due to reduced peripheral resistance. But when calcium channels were blocked in the heart, it will show negative inotropic effect. It will block AV conduction velocity. It will cause bradycardia and decreased cardiac output. So see here, nifedipine is dihydropyridine. Nifedipine is dihydropyridine. Amlodipine is dihydropyridine. Nifedipine acts on blood vessels. Amlodipine acts on blood vessels. Here, the two options are diltiazem and verapamil. Among these two, one will be the answer. Diltiazem is acting on heart. Verapamil is also acting on heart. So how to identify this? How to identify this answer is, see here he is telling the drug will also cause constipation and edema, and it is contraindicated in sick sinus syndrome. So in this, diltiazem will not cause constipation and verapamil will cause constipation. All these actions are similar with diltiazem and verapamil, but when we talk about constipation, verapamil has side effect as constipation, and it also contraindicated in 6NS syndrome. So the answer will be D, verapamil. Let me clarify. Among the following calcium channel blockers, which of the following drug shows negative inotropic effect? All these negative inotropic effect, nodal block, bradycardia, and cardiac output, this will show actions on heart. Here, nifedipine and amlodipine are not showing actions on heart. So, from the remaining two options, diltiazem and verapamil, these both will act on heart. And among these two, what we have to select is we have to select verapamil because verapamil is showing constipation, whereas diltiazem has no constipation side effect. Let me clarify here. See, we have verapamil, and diltiazem. These both are non-dihydropyridines which will act on heart particularly. And dihydropyridines are nifedipine, sustained-release tablet, amlodipine, nicardipine, felodipine, all these drugs, or we have many other dipines. They will act on blood vessels. So we have to select verapamil and diltiazem. So verapamil and diltiazem, in these two, we have to select verapamil because verapamil is showing constipation, whereas diltiazem has no constipation. Simple. And yes, so based on the side effect also, it is very easy for us to understand which drug will be the drug of choice. I think the second question is also clear to you all. Now we'll go back to the third question. Let me read out the third question. Which of the following drug that is not absorbed orally is not a bronchodilator, does not have any direct effect on the smooth muscles, yet is effective in antigen induced, exercise induced, irritant induced asthma, though not all asthmatics respond to it positively. So this is the question. To answer this, see, the answer C is already given, sorry for that. See, which of the following is not absorbed orally? From the first sentence, see, salbutamol is available in oral form, it is available in IM form, it is also available through IV, and mostly it is used in nebulizer form as inhalant. So salbutamol is available through oral route. So salbutamol is not the option because here in the question they have given which one of the following is not absorbed from oral route. So salbutamol is the not option. Mantelucast is also available in oral form. And the third option, sodium chromoglycate, this drug is not effective through oral route. This is very important point. So we can suspect this one. And terbutaline is available in oral form, IM form, and also IV form, and mostly it is given in nebulization form. So from the first point itself, which one of the following is not absorbed orally? From this point itself, we can easily tell sodium chromoglycate is the correct option. And here it is not a bronchodilator. Actually, salbutamol and terbutaline both are bronchodilators, and montelukast and sodium chromoglycate both are not bronchodilators. It is indirect bronchodilator, but still. So here C is also it is not a bronchodilator, so it is satisfying this sentence also, and it does not have any direct effects on smooth muscles. Yes, sodium chromoglycate is not having direct smooth muscle actions because it is not either dilating the smooth muscles of the bronchioles or it is constricting. Actually, salbutamol and terbutaline both are beta 2 agonist, and montelukast is a leukotriene receptor antagonist, and sodium chromoglycate is the mast cell stabilizer. So through that, it will show anti-asthmatic property. And this answer is actually in some books they have given wrong answer, but the correct answer is C because sodium chromoglycate is not absorbed through oral route. Remaining all drugs are absorbed through oral route. So I think this third question is also clear to you all. Now we'll go with the next question. This is very easy question. Even this is also the question which is asked in 2021 last year in Gpat examination. Let me read out the question. A condition in which there is severe loss of extracellular fluid due to hemorrhage, diarrhea, severe vomiting, or sweating, followed by shrinkage of the blood volume, reduction of the venous inflow to the heart, reduction in cardiac output, and fall in the blood pressure. This condition is known as the whenever patient has hemorrhage or diarrhea or vomitings or sweating, in all that conditions, blood volume will be decreased and patient will have severe dehydration and patient will have hypotension, and that hypotension will lead to shock. Simple. So in this condition, what is the exact answer? We have options like hypovolemic shock, septic shock, anaphylactic shock, and cardiogenic shock. See, among these four options, hypovolemic shock is the correct answer. Why? Because when volume of the blood is decreased due to hemorrhage or due to diarrhea or due to lack of water intake or whatever maybe there is, not due to burns also, when body burns, patient will develop hypovolemic shock. And septic shock is the condition where patient develops hypotension due to chronic or due to sepsis. There is a condition called sepsis. If a patient develops hypotension due to sepsis, that condition is called septic shock. Here we don't have any sepsis. And third condition is called anaphylactic shock. Anaphylactic shock is that condition where patient will develop hypotension due to inflammations in the blood vessels due to antigen antibody reactions or due to allergic reactions or due to some other organ transplantations, whatever the reason is. That condition is called anaphylactic shock. Anaphylactic shock is allergic condition where patient will develop hypotension and through that patient will develop shock. That is called anaphylactic shock. So here there is no anaphylaxis. And cardiogenic shock is the condition where heart is inappropriate to pump the blood, especially in heart failure conditions. In heart failure conditions, heart will not pump the proper blood to the tissues, so perfusion will be decreased and patient will develop hypotension, and that condition is called cardiogenic shock. So here there is no cardiogenic shock. This is very simple. When patient has hemorrhage, diarrhea or dehydration, patient will develop hypotension. That condition is called hypovolemic shock. Simple. So the answer for the fourth question is A. I think this is clear to you all. Now the final question is, this is a little bit interesting question. A 3-year-old child presented to OPD, outpatient department, with the symptoms of influenza. So patient has influenza symptoms, flu-like symptoms, and aspirin is contraindicated in this patient because of what risk is the question. So aspirin is contraindicated in many conditions. Aspirin is contraindicated in dengue. Aspirin is contraindicated in thrombocytopenia. Aspirin is contraindicated if the patient has aspirin allergies, and aspirin is also contraindicated in Stevens-Johnson syndrome conditions. Here, patient is having influenza. So, in influenza, why aspirin should be contraindicated? Here, the patient is not having any gastric bleeding disorder. Here, the patient is not having any thrombocytopenia, and patient is not having any risk of Fanconi syndrome. Fanconi syndrome is the condition which is associated with kidney disorder. And Rare syndrome is the condition which is usually caused due to due to influenza and due to aspirin. So patient is having risk of producing race syndrome here due to influenza and also due to aspirin. So here we have to contraindicate aspirin because patient may develop race syndrome, not gastric bleeding. Here we don't have, here in influenza there is no gastric bleeding is seen, there is no thrombocytopenia is seen, there is no Fanconi syndrome is seen. In influenza, patient will have race syndrome. Because of that condition, aspirin is contraindicated. So the option for the fifth question is D. This is the last question in the discussion. So these are 5 questions which were asked in the previous year 2021. In next lecture, I'll come with few more questions. We will discuss this type of questions so that if any such question is asked in the Gpat examination, he'll be able to answer in upcoming Gpat examination. Thank you all. That's it for today.